By combining manual therapy with TCARE technology, it will be possible to treat several pathological lesions of the musculoskeletal system, as tendinitis, bursitis, capsulitis, osteoarthritis, muscular lesion, joint strain traumas, back and neck pain. We start with lower back pain. Now I'll show you the treatment for lower back pain. We start with a cream. I put the rotating plate under the belly. The frequencies of the session is 2-3 sessions per week in alternative days. Duration of the session 20 minutes, 500% capacitive treatment and half treatment with a resistive electrode. I show the frequencies from 420 to 500 kHz. Emission mode continuous. So now I set the equipment and I start the treatment. I start with the capacitive electrode. Now is in working modality because I can see the lead in the piece. So I start to warming up the tissues and I choose a power of 25% of total power, and the patient must have a thermal sensation 3 out of 5 as a general indication, but then must be customized with respect the patient characteristic. For example, in herniated disc case, lower powers are used, and it also treatment nerve course in lower limb. But now in this specific case, in lower back pain, I work with capacitive in the muscle tissues, and the target is improve the temperature of the tissues. And I work in this modality combine manual therapy with TCARE treatment. So I can choose different modality of manual treatment, massage, mobilization, and treat all the surface of the muscles. After 10 minutes of capacitive treatment, I change with the resistive electrode and I start the treatment. In resistive treatment, I choose to treat the bone and the tissues around the bone to have a lower effect of diathermy therapy. So I treat all the bone part of the back, and I work in the bone, in the facet joint, near sacroiliac joint, to warming up the deeper tissues. And I have to move continually, move the electrode to avoid to burn the tissues. And in this modality, when I combine the manual therapy with the diathermy effect, is a very pleasure treatment for the patient that have an instant effect of decrease of pain, and it's very useful, this type of treatment before, for example, manipulation therapy, because I decrease the contraction of the muscles, so manipulation is comfortable for patient, and I can realize the lock about manipulation without pain and in a very easy position. Now you can show the pulse mode, as you can see in the piece, and this type of treatment allow to me to treat in a fixed position and create a mobilization of the articulation. So I can stay for 3-4 seconds in the same position, avoid to burn the patient. Now I change the electrode and I use bipolar electrode that I explained to you is used in aesthetic medicine, but also I can use this type of treatment in musculoskeletal disease, because with this type of electrode my target is warming up quickly the superficial tissues. So I choose this type of treatment when I want to prepare the tissues, for example, before manual therapy, before, for example, high velocity, low amplitude technique. So it's very useful in this type of treatment. And I have to use this type of handpiece, this type of electrode very fast, faster than other electrode, because in this modality I avoid to burn the tissues of the patient. As you can see, I have an increase of the temperature, because you can see in the skin is red for the increase of the vascularization of the skin. The thermal sensation is about 3, maximum 4 out of 5. It's important with this type of electrode start and stop quickly the application of the electrode.